Some are calling it dangerous, others are calling it garbage. But UnitedHealthcare says its new policy will help them save millions of dollars.
They're hoping this policy will force people to seek medical attention with a primary care physician instead of going to an ER. Denver 7's Sloan Dickey is taking a closer look at that policy and what it means for your cost of care.
I think this policy is really concerning for consumers.
Public backlash over a new UnitedHealthcare policy scrutinizing claims for emergency room visits.
This will end up discouraging use of the ER when somebody might actually need it.
According to the policy, UnitedHealthcare would take a closer look at emergency room visits to determine if the visit was in fact a medical emergency. If they determined it to be non-emergent, the visit would either not be covered or there would be limited coverage.
It's hard for your average person to know whether the insurer will think it's an emergency, whether the ER might think it's an emergency. And it really makes it challenging for consumers to know whether they should go to the ER or not.
UnitedHealthcare says their goal is to crack down on unnecessary use of an ER. According to a 2019 study, the company says some of the most common conditions treated in the ER include cough, flu, dizziness, headache, and back pain, and that 27 million of 46 million annual visits to an ER can be treated by a primary care doctor.
It makes the assumption that all consumers can have the choice of not going to the ER and going to other lower intensity sources of care, whether that's primary care doc or urgent care. And that's not a fair assumption.
The American College of Emergency Physicians called the new policy dangerous in a statement asking the company to remove the policy. The American Hospital Association said it would have a chilling effect on patients seeking emergency service. Adam Fox with the Colorado Consumer Health Initiative agrees.
I hope that they back away from this policy entirely because it is fundamentally harmful to consumers.
He believes it would disproportionately affect some Colorado communities.
You may end up with the lowest income, low wage workers having the most outsized impact of a policy like this. And that is fundamentally unjust.
UnitedHealthcare says avoidable ER visits cost the healthcare industry nearly $32 billion annually and says it's driving up costs for everyone.
Because it's a 24/7 service and because it can literally bring anything to bear to manage the situation, that's why it's expensive. More expensive than a primary care office.
Emergency room physicians like Dr. Eric Hill of the Aurora Medical Center say all urgent health concerns should be attended to.
Emergency care is complex. You got a lot of different things, moving parts, different types of bills may be involved between the hospital, the emergency physician, possibly radiology.
He says there's some things patients with insurance can do to prepare, including establishing a relationship with a primary care doctor.
A lot of people that have insurance have never actually established a primary care doctor because they otherwise feel healthy and they just don't go to their routine annual physicals, even though it's basically an entitled benefit in most insurance plans.
Sloan Dickey, Denver 7.
And a big question is, how will the insurance company decide which claims to accept or reject? The insurance company will look at things like initial concerns that led you to the ER, pre-existing conditions, or the care and services provided in that ER. But let's take a closer look at why this isn't so black and white. The CDC is reporting that 3% of emergency room visits are non-urgent. 90% of symptoms between an urgent medical condition and non-urgent overlap. The American College of Emergency Physicians says they think this policy is illegal. The group is still suing over a similar policy introduced in 2018 by Anthem, but they haven't said if they would take legal action in this case. And looking closer at that 2018 policy, Anthem announced it wouldn't cover emergency room visits if the medical condition wasn't an emergency. Like UnitedHealthcare, they believe emergency rooms are an expensive place to receive routine care. So in the end, patients were left on the hook with the bills. The lawsuit in this case is still pending. And as for UnitedHealthcare, they say their policy complies with federal regulations and the layperson standard.
So what is the prudent layperson standard? Well, it's a federal law that protects patients, ensuring anyone can receive emergency care regardless of insurance status or ability to pay. It requires insurance companies to provide coverage for emergency care based on symptoms, not the final diagnosis. So, for example, if a person goes into the ER with chest pain, thinking they're having a heart attack, but it's just an anxiety attack, not a cardiac event, that ER visit should be covered according to this standard. UnitedHealthcare says their policy is consistent with this because a provider has the chance to attest to that medical care.
And we're already seeing the backlash on social media over UnitedHealthcare's policy. Seth Truger is an ER doctor at Northwestern Emergency Medicine. He's also the digital media editor for the JAMA Network Open. And in a tweet, he called the policy garbage, writing, "This will throw babies out with the bathwater." Philip wrote on Twitter, "I've started treating post-hospitalization UHC nurse check-ins like Mirandized police interviews. Anything I can say and will be used to deny me coverage. They're not interested in helping, just profiting." Another person writes, "Why do they get to deny claims? Their job is to pay, not make medical decisions."
So let's take a deeper look at what happens if your claim is rejected and the insurance company deems your ER visit as non-urgent. Well, you can challenge that decision. The patient must submit a formal appeal, and like we mentioned, a provider can also attest to the emergency needs. If that is submitted in the given time frame, United will cover that visit.
And originally the change was going to go into effect July 1st, but after public backlash, today UnitedHealthcare decided to delay the start of the policy change until the pandemic has ended. So it's not clear what they'll do next. In the meantime, we want to hear from you. We know the cost of care is so hard to navigate. So email us your thoughts at 360@thedenverchannel.com.